Welcome back to the Deep Dive. Today, we're really getting into something huge, something that affects millions: anxiety and depression.
Yeah, these are complex emotional landscapes for sure.
Absolutely. And we've looked at a whole stack of sources, trying to boil it down so you can clearly understand what these conditions are, how they work, and maybe most importantly, how they're treated.
That's the goal. We want to give you a clear mental map today. Draw a line between that everyday nervousness or sadness, which, let's face it, we all feel sometimes, and the actual clinical disorders.
Right.
And we'll dig into the causes, the biology, the genetics, the environment, and explain why treatment isn't just helpful, it's necessary and multifaceted.
And let's just get this out there right away, because it's probably the most critical point from all the research. Neither anxiety nor depression is some kind of weakness. It's not a character flaw. You can't just snap out of it. That's a myth. These are common, they're serious, and this is the good news, they are very treatable conditions. Okay, so let's start with anxiety. We sometimes forget that feeling anxious isn't always bad, right? It can actually be useful.
Oh, for sure. That little bit of jumpiness, it helps us focus, spot danger, keeps us safe. It's like our body's built-in alarm system.
But where does it cross the line? When does that helpful alarm become, well, a disorder?
It crosses the line when that alarm bell just keeps ringing, way out of proportion to what's actually happening.
Okay.
When it seriously messes with your ability to function day to day, and you feel like you just can't shut off the physical feelings or the worried thoughts, that constant state of high alert, that's the disorder.
Got it. And then there's depression. Major depressive disorder, or MDD. That's different from just feeling down for a bit, isn't it?
Absolutely. We're not talking about a bad week. MDD is a mood disorder. It's characterized by this persistent feeling of sadness, hopelessness, maybe emptiness.
And losing interest in things.
Exactly. Losing interest in things you used to enjoy. It impacts how you feel, think, and behave over a long stretch of time. And it's surprisingly common. Something like 1 in 6 people will go through a major depressive episode in their life.
1 in 6. Wow. And often they come together, right? The sources talk about comorbidity.
Yes, that's a huge point. Comorbidity. Anxiety and depression often go hand in hand. If you have one, your chances of having the other are significantly higher.
So if you're diagnosed with depression, you might also have an anxiety disorder, or the other way around.
Precisely. And that makes diagnosis and treatment trickier. You have to figure out which one is sort of driving the bus or how they're interacting.
Because they share symptoms?
They do share quite a few symptoms. Physically, think headaches, general body aches, stomach problems.
Sleep issues too, right?
Yeah.
Like sleeping way too much or barely at all. And eating changes.
Exactly. Big disruptions in sleep and appetite are common in both. And then cognitively, you see problems concentrating, feeling really irritable, or just feeling constantly keyed up or on edge. It's like your whole system, mind, mood, body is just overloaded. Now, to really understand anxiety, we need to look beyond just that general feeling. The diagnostic manual, the DSM-5, actually classifies several distinct types. Knowing the differences is key for getting the right kind of help.
Okay, so break down the main types for us. What are we generally looking at?
Well, probably the most common are specific phobias. These affect maybe up to 12% of people in the U.S. It's an intense, really disruptive fear of a specific thing. Could be flying, spiders, heights, you name it.
And it really gets in the way of life.
It does. Then there's agoraphobia. That's the only phobia that gets its own separate diagnosis. It's an intense fear of being trapped somewhere, unable to escape or get help if something happens. So people might avoid crowds, public transport, open spaces.
Okay, so those are tied to specific things or situations. What about the kind of anxiety that just hangs around?
Yeah.
Like all the time?
That sounds like generalized anxiety disorder, or GAD. That's where you have excessive, frequent, often unrealistic worry about just everyday stuff, your job, your health, chores, finances. It just feels constant and uncontrollable.
It sounds exhausting.
It is. Then you've got panic disorder. This involves having multiple unexpected panic attacks. They often come out of the blue, seemingly without warning.
In those panic attacks, they feel physical, right? Like you're actually having a medical emergency.
That's the really scary part. Your heart pounds, you can't catch your breath, you might feel dizzy or shaky. People genuinely think they're having a heart attack or dying. Many end up in the ER.
Understandable. What else?
There's social anxiety disorder, sometimes called social phobia. This is an intense, persistent fear of being watched, judged negatively, or embarrassing yourself in social situations. It affects about 7% of the U.S. population.
That's quite a lot of people struggling with social interactions.
It is. We also need to mention separation anxiety disorder. We often think of it in kids, but adults can have it too intense fear about being separated from important people in their lives. And finally, the least common is selective mutism, where someone, often a child, is unable to speak in certain situations due to fear, even though they can speak fine elsewhere.
So a whole range of ways anxiety can show up, and the symptoms themselves fall into two camps.
Right. You have the psychological symptoms, that feeling of panic or dread, constant uneasiness, feeling on edge, maybe uncontrollable, obsessive thoughts racing through your mind.
And then the physical side, which can be just relentless.
Yeah, absolutely relentless. Heart palpitations, shortness of breath, tight muscles, maybe numbness or tingling, nausea, and definitely trouble sleeping. Insomnia is very common. These aren't just in your head. They are real, measurable, physical things happening because the nervous system is stuck in overdrive. It really shows how linked the mind and body are in these conditions. Okay, shifting gears a bit to major depressive disorder, MDD. For a diagnosis, certain core symptoms need to be present most of the day, nearly every single day, for at least 2 weeks.
And emotionally, what does that look like?
It's often a deep sadness or a feeling of emptiness or hopelessness, but sometimes, especially in certain people, it can show up more as irritability or angry outbursts.
Interesting. And behaviorally, you mentioned the loss of interest earlier.
Yes, that's a key one. It's called anhedonia, losing interest or pleasure in almost everything you used to enjoy. Hobbies, sports, seeing friends, sex. Nothing feels good anymore. And there's often this profound loss of energy, this fatigue, where even tiny tasks feel like a huge effort.
Like climbing a mountain just to get out of bed.
Exactly. Then you have the cognitive symptoms, feelings of worthlessness or excessive inappropriate guilt, trouble thinking clearly, concentrating, making decisions. Even speaking can feel slowed down.
And physically. We touched on sleep and appetite changes with anxiety overlap. Same here.
Very much so. Significant sleep problems, either sleeping way too much, that's hypersomnia, or not being able to sleep, insomnia. And definite changes in appetite, often leading to noticeable weight loss or gain without trying.
And it's important to know these symptoms don't look the same in everyone, especially across different ages, right?
Crucial point. How depression presence can really vary by age. In younger kids, you might not see obvious sadness. It might look more like clinginess, being really irritable, complaining about aches and pains, or suddenly refusing to go to school.
Things you might not immediately connect to depression.
Right. And then at the other end, in older adults, depression is often missed. It gets mistaken for just part of getting older. Well, symptoms might show up as memory problems, personality shifts, unexplained aches and pains, fatigue, or losing interest in things like sex or food. If there isn't a clear medical reason for these changes, depression should definitely be considered. It often goes undiagnosed in this group, which is a real problem.
Looking at how severe and life-altering these symptoms are for both anxiety and depression, the big question is, why? Why does this happen to people?
And the clear answer from all the research is there's no single why. It's not that simple. We really have to understand that these conditions are multifactorial.
Meaning lots of things contribute.
Exactly. It's a complex mix of biology, genetics, and your environment, your life experiences.
Okay, let's break that down. Starting inside the brain, the biology, what's going on there?
A lot hinges on brain chemistry, specifically neurotransmitters. These are the chemical messengers that neurons use to communicate.
Like serotonin.
Serotonin is a big one, often linked to mood, well-being. Also norepinephrine, which is involved in alertness and the fight-or-flight stress response. Dopamine plays a role in pleasure and motivation. And GABA is sort of the main inhibitory calming neurotransmitter. Imbalances in these chemicals and how they interact within specific brain circuits, like pathways that regulate mood and stress, seem to be key.
So it's not just the chemicals, but how the brain's wiring uses them.
Precisely. And we can actually see some changes. For example, studies show that in people with anxiety disorders, the amygdala, that's kind of the brain's fear center, is often hyperactive, especially when presented with things that trigger worry.
Wow. So you can literally see the fear center working overtime on a brain scan. That really drives home that this isn't just psychological, it's physiological.
It absolutely is. It demonstrates deep biological roots. Then you add genetics to the mix. We know both anxiety and depression tend to run in families.
Meaning you can inherit a predisposition.
Yes. It suggests certain inherited traits can increase your risk. Doesn't guarantee you'll develop the condition, but it makes it more likely, especially when combined with other factors. Hormonal changes are another biological piece. Think pregnancy, postpartum, menopause, even thyroid problems. These shifts can definitely trigger or worsen depression.
Okay, so Biology and genetics lay some groundwork. What about the outside world? Environment, stress.
Huge factors. Experiencing severe or chronic stress or going through traumatic events, these can really disrupt that delicate neurotransmitter balance we talked about.
So stress isn't just in your head. It physically changes your brain chemistry.
It can, yes. And that leads us to specific risk factors the sources highlight. Things like having a chronic illness, like cancer, or recovering from a stroke, dealing with ongoing financial hardship or difficult relationships, even things like lacking basic resources, stable housing, enough food, access to healthcare, low self-esteem is another one. And of course, substance abuse is often intertwined. It can be both a trigger and a way people try to cope, which usually backfires. Right, so someone is experiencing these symptoms. What's the path forward? It starts with getting a proper diagnosis.
Which isn't just a quick chat, right?
No, definitely not. And importantly, there's no blood tests for anxiety or depression. So first step is usually a medical evaluation with your doctor. They need to rule out any underlying physical conditions that could be causing the symptoms, like, say, an overactive thyroid mimicking anxiety.
Makes sense. Rule out the physical stuff first.
Exactly. Once that's done, a mental health professional, a psychiatrist, psychologist, therapist will do a thorough assessment. They'll use criteria from the DSM-5, looking at the specific symptoms, how intense they are, how long they've been going on, and critically, how much they're interfering with your daily life, your functioning.
And once that diagnosis is made, the key message seems to be treatment works.
Yes. Treatment is effective, and it's usually tailored to the individual. You can't just will it away, but there are solid strategies. Often it involves a combination of medication and psychotherapy, or talk therapy.
Let's talk therapy first. What kind?
The gold standard, especially for both anxiety and depression, is cognitive behavioral therapy, or CBT. It's very practical.
How does it work?
CBT helps you learn to identify those negative, often automatic thought patterns and the unhealthy behaviors that go along with them. And then it teaches you skills to challenge and change them. It gives you concrete tools.
Okay. And for anxiety specifically, I saw mention of exposure therapy.
Yes, exposure therapy is really powerful for anxiety disorders, especially phobias and panic disorder. It involves gradually and safely exposing you to the feared situation or sensation in a controlled environment.
Sounds intense.
It can be, but it's done carefully. The goal is to help your brain learn that the feared outcome usually doesn't happen, or that you can cope with the feelings of fear. It essentially helps retrain those overactive fear circuits.
Right, rewiring the brain, in a sense. Now, what about medication?
Medication can be a really crucial tool. It helps manage symptoms, often significantly, though it's usually not considered a cure by itself. The mainstays are antidepressants.
SSRIs and SNRIs. Can you quickly break down what those letters mean?
Sure. SSRIs stand for selective serotonin reuptake inhibitors. They work primarily by increasing the levels of serotonin in the brain. SNRIs are serotonin and norepinephrine reuptake inhibitors. They work on both serotonin and norepinephrine.
And one might work better depending on the person's specific symptoms.
Potentially, yes. For instance, SNRIs might sometimes be preferred if low energy is a major issue because of the norepinephrine effect. But both types are common first-line treatments. The key thing with antidepressants is patients, they don't work overnight. It can take several weeks to feel the full benefits.
Good to know. Are there other medication options?
For anxiety, especially acute anxiety or panic attacks, sometimes benzodiazepines are prescribed. Think Xanax, Ativan, Klonopin. They work very quickly to calm things down.
But there are downsides.
Yes, big downsides. They can be habit-forming, cause drowsiness, and you can build up a tolerance. So they're generally used short-term or only as needed and prescribed very cautiously.
Okay. Anything else?
Sometimes beta blockers, which are actually blood pressure medications, are used off-label for the physical symptoms of anxiety, like a racing heart or trembling, maybe before a public speaking event, but they don't treat the underlying psychological anxiety.
Gotcha. So therapy and meds are the pillars. What about other things people can do? Self-care, lifestyle.
Hugely important. These strategies don't replace professional treatment, but they make it much more effective. Things like learning stress management techniques, mindfulness, meditation, simple breathing exercises can make a real difference.
And exercise.
Absolutely. Regular physical activity is a proven mood booster. It actually helps release those beneficial neurotransmitters we talked about. And one really practical tip from the sources: watch your caffeine intake.
Coffee.
Yeah, caffeine can really ramp up the physical symptoms of anxiety, the jitters, the racing heart. Limiting or avoiding it can help. And finally, connection. Connecting with supportive friends, family, or joining a support group can combat the isolation these conditions often bring.
We really need to wrap up by emphasizing why getting treatment is so critical. What happens if these conditions are left untreated?
The consequences can be really severe. We're talking about a significantly decreased quality of life, obviously. Increased risk of developing substance use disorders as people try to self-medicate. For anxiety, it can sometimes lead to developing major depressive disorder. And in the most serious cases, self-harm or suicidal thoughts and actions.
That's incredibly serious. And there are physical health risks too, aren't there? You mentioned the brain changes, but what about the rest of the body?
Yes, that's a vital connection. Constant chronic anxiety with those elevated stress hormones like cortisol always pumping, it takes a toll. It actually increases your risk of serious cardiovascular problems, including heart attacks. That chronic stress response directly impacts the heart and blood vessels.
So the mental distress has direct, dangerous physical consequences.
Undeniably.
Here's another specific link the sources mentioned that I found fascinating and maybe surprising: the connection to smoking.
Ah, yes. The statistic is pretty stark. Something like 3 out of every 10 cigarettes smoked by adults in the U.S. are smoked by people dealing with mental health conditions like anxiety or depression.
Why is that connection so strong? Is it self-medication again?
That's often part of it, yes. Nicotine has short-term mood-regulating effects. But the crucial message here is about quitting. For a long time, there was maybe some concern, even among clinicians, that trying to quit smoking might destabilize someone's mental health treatment.
But the research shows otherwise.
Exactly. Current research is clear. Quitting smoking does not interfere with mental health recovery. In fact, quitting smoking can actually improve mental health symptoms and outcomes in the long run, alongside the obvious physical benefits.
That's really important information. Okay, and before we finish, the most urgent point: if someone listening or someone they know is having thoughts of suicide.
We need to be absolutely clear. This is an emergency. Please reach out for help immediately. In the United States, you can call or text 988 anytime, 247, to connect with the Suicide and Crisis Lifeline. There are people ready to help. Don't wait. #tag outro.
Okay, this has been a really comprehensive look at anxiety and depression. Complex topics for sure, but also, as we've heard, very common and very treatable.
That's the main takeaway, I think. These are real biologically influenced conditions, not signs of weakness. And effective help is available through tailored medical care, therapy, and lifestyle adjustments working together.
We talked earlier about how anxiety involves that hyperactive amygdala, the brain's fear center, and how chronic anxiety physically increases the risk of things like heart problems.
Right. The physical reality of it.
So here's a final thought for you, our listener, to maybe chew on. We've established these conditions have undeniable physical roots, manifesting as real changes in the brain and body. They aren't just a matter of willpower. So how might fully accepting that physical vulnerability, recognizing this is partly a physical illness, actually empower us to better manage and maybe even overcome the psychological trouble that comes with it?
That's a powerful question. Integrating that understanding of the physical component. How does that shift our approach to managing our mental health? Something to think about.
Definitely. If anything we've discussed today resonates with you, if you recognize these symptoms in yourself or someone you care about, please use this information as a catalyst. Take that next step. Reach out for help.
Please do.
Thanks for joining us for this deep dive.